We have been coming together on many occasions over past few years, conducting various activities like specialty medical camps for some special regions and special sections of our community. This year, we had been to the region of one of our friend who had devoted 20 years of his life tirelessly delivering quality medical services at a small tribal village in the northernmost tip of Maharashtra. Multi-diagnostic medical camps were planned with specialists from 6 different branches like ophthalmology, internal medicine, gynecology, pediatrics, orthopedics, and women's health. Two nondescript hamlets in the district of Nandurbar. Difficult terrain, absence of roads and transportation means make reaching out to these places almost impossible. Only a few places can be accessed by foot or else through the water. Despite intensive and selfless efforts of the devoted doctors and field staff of the public health departments, the region is still the lowest in almost all health indices in the country. Some degree of planning was needed to reach to the sites with all the medical equipment and its effective execution. Though the roads were a little treacherous, the drive was beautiful, but that explains why the people here fail to proactively seek medical help for non-emergency situations. Even in life-threatening emergencies, valuable time is lost in reaching the hospitals. After an hour and a half of an adventurous drive, we reached bank of the mighty Narmada river and boarded a boat ambulance. This mobile clinic is a lifeline for thousands of tribals living in the inaccessible areas of the valley. After sailing for one more hour, we reached another bank from where we had to take a small trek to reach this settlement called Thuani. The only permanent structure here that we saw was a humble residential school started by a very devoted group of people working tirelessly for decades for the welfare of the thousands of voiceless tribals affected by the Sardar Sarovar project. We tried to include as many diagnostic equipment and tests as possible to do there and involved specialist doctors of different fields. There is a serious shortage of doctors in the region, with almost 80% of the government hospital posts of specialists being vacant since years. There were so many people who had never been to a doctor before. The nearest eye facility is around 5 to 6 hours away. So many people with problems correctable by mere spectacle continued to live lives with their poor vision. Wearing a spectacle was no less than a magic for them. The region is one of the worst affected in terms of child malnutrition, with 55% of the children in this block being malnourished and 15% severely malnourished. In spite of very limited resources and the infinite struggles that they face for even the basic things, it was very heartening to see that there was not a single case of malnutrition in these shalas. The credit goes to the devoted teachers and the various support groups which run these kind of schools for the most underprivileged sections of our society. An attempt was made to make available most of the commonly required drugs which may not be otherwise available through the public health systems. With the help of some diagnostic tools and equipment, we wanted to understand in some depth the health status of the people of the region. An elaborate health examination sheet was designed and used to collect the detailed information of every person. We could also pick up many high risk cases before they could complicate into serious disorders. We were happy to be of some help to around 210 people by the end of the day. While some of us rested in the boat, others stayed in a guest room of a temple on the banks of the river. This temple was built a few years back after the ancient temple got submerged under the water in the year 2001. Early morning the next day, we started sailing again towards our next camp destination, admiring the beautiful valley and listening to the voiceless stories of the sufferings of the countless people here.
कुठल्याही परिस्थितीत संकोच न बाळगता एकला आपले गोरगरीब लोक असताना एकदम त्यांनी असं मनापासून आणि प्रेरणादायी अशी त्यांनी आपल्याला तिथं सेवा दिली आपल्या लोकांना. त्यामुळं एक आपल्याही मनात आता असं एक भावना निर्माण झाली नाही, काहीतरी त्यांचं आपल्याला देणं होतं किंवा आपलं त्यांच्याकडून घेणं होतं, म्हणून त्यांना एक ईश्वराने त्यांना सद्बुद्धी दिली, एक त्यांना चांगले विचार दिले. त्यामुळं कालचा जो कार्यक्रम झाला तो कार्यक्रम त्यांनी हे अतिशय म्हणजे अतिशय योग्यपणे आणि याच्यामध्ये हाताळला. त्याचबरोबर
शिबिर करता आवला तज्ञ डॉक्टर हारसिन दादो टाइम काढे चाहे पर दुखे आपला शिबिर करता आवलूच है. शिबिरों एक महत्वान वालोच है कि आदन शिबिर में आखान तपासणी होनी से जो गरोदर माता से आयतला पूरा तीन म्हणजे डुलान एक महत्वान से आदन शिबिर में जिंद्र डुलान प्रॉब्लम से चाहे हरिपोर चेक कर लेनो जिंद्रो नंबर हो जर चष्मो अवेलेबल हो तो आजच आपण्यास येता, जर चष्मोनी बनी शकतो तर नंतर पुन्हा दोखा आम्ही बनावीन तुम आपण्यास येता. अजून कुणी दमान जर त्रास हो तो एक मशीन से स्पायरोमेट्री करून चलावलाच येता जो आपण दमान कोतरी कॅपॅसिटी से चौकइतलो कारण त्या मशीन पर भी चेक कर लेनो. एक 1000 माइलो मशीन एकदम महागड मशीन से जो तिने मैं आपण दम कोतरू लागतो काय से डाया माणन करतात जो हा जो से तो जो बीपी शुगर छातीन पट्टी या आखा करण्यास येता. तिना माय तो ज्या आजारी निकले तीनो तोले आपण ट्रीटमेंट आपण्यास आहे. आज विशेष करून आम्ही काल दोखा शिबिर में फिरला पण या हरिपोर जो पीएससी स्टाफ से आम्हा एकदम हाजो सहकार्य करो. आम्ही काल दोखाच्या कंटिन्यूस आमरे आते से आणि प्रत्येक जण मेहनत
पुण्याहून डॉक्टर आलेले आहेत, सगळं तज्ञ डॉक्टर आलेले आहेत, भरपूर लोक आलेले जमलेले आहे. आता 3-4 वाजले तरी काय पेशंट संपले नाही आहे. तरी
म्हणजे शुगर डोळ्याची तपासणी साथीला तपासणी म्हणजे नाशिक पुणे रोज डॉक्टर आली म्हणजे आपण हाजोच आहे आज आखान हाजोच तपासणी म्हणजे आभार माना आम्ही पास.